In a bid to strengthen the capacity of supply chain officers across various cadres in the Edo State Health Sector, the National Product Supply Chain Management Program, in collaboration with the Edo State Primary Healthcare Development Agency, under the leadership of the Executive Secretary, Dr. Kozin Ohaimere, has organized a two-day integrated logistic management information system training. The training is aimed to equip participants with the knowledge and skills required to effectively manage health logistics data, analyze supply chain trends, and make informed decisions in the state health sector. The facilitators, Mr. Ibrahim Tajuddin and Sandra Nwachukwu, educated participants on the critical role logistics plays in the success of health programs, emphasizing the importance of accurate data management and timely decision-making in ensuring availability of essential medicines and health commodities.
You cannot have a data management if your NMIS tools, whether paper, electronics, is not collating. I'm not saying collecting, no. You can collect, but don't collate. If your LMIS tool is not collating accurate and quality data across all levels, forget it. What you will be doing is you will be doing push. You will not do pull. If you have good logistics management information system, it will give you good data for your quantification, and at no point you will run out of stock. It will also help you when it comes to the needs of your customer or your client.
Consumption is the average quantity of the product, right, dispensed to user or patient in the most recent 3 months, 2 months, depending on your review period and the case. You can find actual consumption data in only one place, right? The consumption records such as your daily activity registers, daily using logs or tick sheets, or as applicable to your facility, the documents you utilize there. Average number of each commodity dispensed, issued to clients and patients in a given month. So the typical calculation form, the typical formula for having monthly consumption is the quantity consumed or dispensed over a reporting period in months over that reporting period of that program. So we have various programs here. Probably here there are different reporting periods, so that can guide our calculations here. So for those who are with the HIV, malaria, family planning, what are your reporting periods?
The Director of Pharmaceutical Services, Ministry of Health, Edo State, Dr. Mrs. Tiveri Osa-Afe, noted that the training is essential to improving health outcomes in Edo State. She urged participants to not only apply what they have learned, but also to share the knowledge with their colleagues to foster broader impact.
This training was organized by the National Product Supply Chain Management Program of the Department of Food and Drug Services, Federal Ministry of Health. The program actually is to enlighten those in the supply chain system in Edo State that involves supply of drugs and other health commodities, what the various processes, and also to get good data that are accurate, concise, and now for decision making. Because the truth is, outside getting the correct data, if we don't do that, we won't be able to plan ahead for our supply chain system. The state will not even know what quantity of commodities are being consumed by the state, what services are being rendered in the health facilities. So with this training, it will go a long way to update that which we have already known before, and to now create a very conducive environment for our supply chain management in the state. And we also expect that if you look at the participants, the cuts across the local government, or when we say cut across the local government, that at each local government you have focal persons that are responsible for drug supply activities. So you have them here, both local government and at the state level. You also have the logistic management coordinating unit of the Ministry of Health, they are here, and it is expected that every participant, when they go back to their facility or go back to the organization, they're supposed to do a step-down training for all members of the supply chain in their various facilities.
The training underscores the government's ongoing commitment to improving health system through data-driven logistics and strategic capacity building. In Benin City, Faith Dibia, reporting for Afema Reporters TV.